Welcome back to the Bumper Breakfast. I have two doctors in the studio with me this morning. One, I'm biased towards women. No, don't be answering me or don't be answering me. I am totally biased towards women. Totally biased towards women. I have Dr. Olubumi Ogbodo here with me this morning on the Bumper Breakfast. She is with Anaga Executive.
Anaga Consulting Limited.
Yes, she's with Anaga Consulting Limited. She is the executive director, something.
I'm a senior consultant.
Senior consultant, yes, because I know that somebody sent me something.
Senior consultant.
I want to be able to introduce you properly. All right. She is the team lead at Anaga Consulting Limited, implementing the private sector component, United States Agency for International Development, USAID, and tuberculosis local organization network, TBLON3. We also have Dr. Shokoya Olushola Daniel, who is a deputy director and program manager, State Tuberculosis, Leprosy and Buruli Ulcer Control Program Directorate of Disease Control, Ministry of Health. Ladies, good morning.
Good morning.
Good to have you both on the show this morning. I've been looking for this duo for a very long time. This conversation is 2 months late. Right?
You're correct.
Very correct. All right, let's talk this morning about tuberculosis. A lot of people do not take it seriously, like it's a current concern. But Lagos State government has a department taking care of that.
Yes.
That spells urgency
Yes.
and seriousness. Talk to me.
Yeah, tuberculosis, as we know, is a communicable disease
Okay.
that is as old as the First World War. It's a very old disease, but currently is one of the leading causes of death, single agent that cause death. Follow the second to COVID-19. Now we have 9.9 million people falling ill of tuberculosis on a yearly basis. According to the World TB report for 2021 from WHO, we have over 1.3 million deaths due to COVID and due to TB in the world last year. Now, currently in Nigeria, we are supposed to have an incident, estimated new cases of disease over 450 million, but we would notify about 200 million and about 200,000. So with a missed case of over 250,000. So that means.
And you're talking here?
Yeah, I'm talking about Nigeria. I just gave you a global statistics. I'm also narrowing down to Nigeria. We are supposed to notify about 450,000 cases annually, but we notify over 200. This is national data. Now that means if you minus 450
from 200,
we have 250 missed cases that we've not identified, detected, and it's within us.
So what you talk about now is notify them, which means you're doing the same contact tracing like you do with COVID?
Yes.
Is that serious?
Serious. I said it is the second leading cause of death, single agent cause of death, apart from COVID. COVID is
in the
first
world.
in the world. COVID is first, followed by TB.
Wow. And where does Anaga Consulting come into all of this?
Thank you. So Anaga Consulting is a global healthcare advisory firm, and what we are doing on this particular project is we are increasing the private sector response to TB.
Okay.
To increase awareness for TB in the private sector space,
Okay.
and to also build capacity for private sector, the occupational physicians, to be able to detect TB faster in the workplace through different measures. We have mobile screening app that we also deploy.
A mobile screening app
for TB. It's called MAX, mobile app for TB screening, that we deploy to private sector firms. And we also encourage private sector firms to have a workplace TB policy in place. Unfortunately, Nigeria has the highest burden of TB on the continent of Africa.
What number in the world?
Sixth in the world,
Sixth in the world,
first in Africa.
first in Africa.
Did you just say 6?
Sixth
Yes.
in the world, first
First
in
in
Africa.
Africa.
So we're in trouble.
Yeah, but
We are in trouble.
And we're
people
pretending
are
not to
aware.
know.
Yeah. Some maybe a quarter of people are not even aware that TB is still a problem.
Okay. So
Study shown that from what TB reports from WHO says that less than 30% of our population, less than 30% of our population are aware of signs and symptoms of tuberculosis.
So let's talk about the signs and the symptoms and what causes this thing.
Okay. Now, the signs and symptoms, TB is an airborne disease.
Okay.
It's transmitted by aerosol, by recovering transmission from infected person to the next person by air droplets through coughing,
Same way as COVID.
same way as COVID. Now, the signs and symptoms are similar, but for TB, you have, first and foremost, you have cough of more than two weeks duration. Once you have a cough of 2 weeks duration, then it is consider you have COVID, consider you have TB. Now you may have plus or minus fever. Fever in TB is usually low grade. You have chest pain, difficulty in breathing and chest pain. Then one significant thing that is also very common is weight loss. Once you see someone coughing and is having loss of weight, then it is COVID or TB. Sorry, it is TB, but it's proven otherwise. You know why I'm missing TB than COVID.
Yeah, because they're in the same category right now.
Yeah, I'm missing them together. So is once you have someone with cough and weight loss, it is TB or proven otherwise. Then you also have night sweat. When you start sweating profusely in the night,
Even when it is cold.
When it's cold. Do you understand? Then when it's complicated, you might have hemolysis, that's coughing out of blood. You have that. Once it's complicated, in complicated cases, you may have that. These are the cardinal signs of TB. Once you have those things, you go to the United
Is it that anything in particular causes this?
It's caused by Mycobacterium tuberculosis. It's a bacillus, it's minute germs that usually affect the lungs. Mycobacterium tuberculosis. That's the name of the agent causing TB.
But can it be treated?
Yes, good. That's why I wanted you to take me to. Now, the good thing about TB is that it is curable. It's curable, it's treatable, then it's curable. Just take your drug for 6 months and you'll be okay. Now,
They all 6 months
6 months, yes.
of religious drug
Daily.
swallowing.
Yes.
No injections.
No injection.
Just swallow.
Oral drugs. You take it orally for 6 months. And the good thing about this is, out of all other infectious diseases, other diseases that is of public health importance, like hypertension, diabetes, malaria, asthma, and so on, even HIV. Most of those diseases I mentioned are not curable.
Yeah.
You don't only manage them.
Yeah.
If you have hypertension, you manage it for the rest of your life.
Yeah.
There is not, cannot
It's
cure
not.
it.
It's not curable.
But TB is curable. TB is curable. Take it for 6 months, you'll be okay. Religiously, for 6 months, you'll be okay. You'll be cured of it. Like HIV, you take your drug, but you manage it for the rest of your life. Hypertension, you manage it for the rest of your life. Diabetes, you manage for the rest of your life. Asthma, you manage for the rest of your life. But TB, take it for 6 months. You're okay. You'll be cured. Now, you can get all our treatment, maybe you can get treatment from all our public health facilities, in government-owned public health facilities in Lagos, and also some select private facilities. Not all private facilities, select private facilities in the state. You can access help, go there, and treatment again. Treatment is free. Treatment is free. Diagnosis to diagnose TB using gene expert is free.
So
and no cost
to diagnose is free. To treat is free.
That drug
So-
I'm going to take for 6 months, we'll give it to you free.
Okay,
Not
so
paying anything.
everything you're talking about is free. What is stopping people from going to access the care?
That is why we are here.
Awareness.
So people do not know.
People do
No,
not
no.
know.
So you're coughing, and you're coughing for 2 weeks, you should just assume.
Yes.
Okay.
You are coughing more than 2 weeks, and then you have 2 or more of the symptoms, signs and symptoms I mentioned, like you're having a weight loss, night sweat, you're having chest pain, difficulty in breathing.
Just
You got to-
assume.
So just go to the hospital.
A
And let-
public hospital.
or a private, select private facility, not all
Because,
private facilities.
because we may not know which of the private
But go to
facilities
government. Go to
are
government.
select. So, but all the government facilities,
Yes.
primary
Yeah.
healthcare center,
General hospitals and permanent care centers. Go there. It's free.
and
Go
treatment
there.
is free.
Treatment is free. You are not paying
You
anything.
can put your choice.
To get the drug.
The treatment, the drug you get is from one of our
They will not
partners.
ask us to go and do test.
No, you do a test. The
You
test
pay
is
for
to.
it.
The test is genius part. Is to
It's-
for you
it's
to
free.
know. The test is free.
That's what I'm saying.
It's
You will
free.
not pay for test.
You not pay for test.
You will pay for card. That one is 300 naira.
That's fair.
And we pay for parking space. But anyway, if you're getting to pay 500 naira, because I think the car is about 300 naira, and the car parking is about 200 naira. So pay 500 naira, you're getting 6 months for free. I think it's just like,
Since you are getting your
It's a win for
diagnosis is free. For you
and
to
we're not
get-
paying for consultants.
You're for government hospital you won't pay for consultation, but
Okay.
for private you pay.
You pay for
It's not free.
consultation.
It's not free. But the
Public
treatment-
hospital, primary health care center.
It's free. The diagnosis again, so that there is no confusion. Diagnosis, when you go there, they take your sputum, they
Okay.
will take it and then go and examine it. The GNS part is a machine that detects TB. So
But we
that
don't need to see the machine.
you don't need to see the machine.
So the point is just that government
Give us-
has the machine.
You have the machine, then give us your sputum, you go and examine it free. Then we
Please
tell you
explain
test.
what sputum means, because the
Sputum
people think you're
is
putting
your-
something in their
Sputum is when you cover out some
phlegm, like,
phlegm.
Phlegm.
like what's Yoruba's called kelebe.
Kelebe, exactly. Kelebe. I don't know what to call it in English. It's phlegm. I think you are right. Phlegm is phlegm. So you
Phlegm.
bring it out.
The medical is sputum, is not saliva, it's just kelebe. Give us your kelebe, and we use your kelebe
Once we use
to
the
do,
kelebe, and then we go and test it.
and
We tell
we are
you-
not using it for any sham to make money.
Aye, that's another thing.
That's another
That's another thing we need to talk about, because you just made me. You've gone to that aspect. Nobody can use your kelebe for anything, especially in our facilities. Nobody, because you see.
You know what? I've had all sorts. I have to be like, you're not using it for shampoo.
See, and again, I need to go, since this is one of those things we talk about TB, stigmatization. So we need to, you're taking me to stigmatization now.
Yeah.
Now, one of the challenge we have in TB program is we have a lot of stigmatization.
Okay.
We have a lot of people, TB, this and that. You try to avoid the person because he has TB. Someone that has hypertension, you ostracize the person. Someone that has diabetes, you ostracize the person.
But it cannot run you. In the case-
I'm going there.
in
I'm
the
going
case
there.
of-
I'm going there. I'm going there. No, we understand TB is an infectious disease. That is communicable.
Yeah.
But one thing I want you to know: once you start your drug, for the first, some books will say, some school of thought will say, from one month, 1 week, or let's say 2 weeks, you are no more infectious. Once you take your drugs religiously,
You're just waiting to be cured.
The first 2 weeks, it's 6 months. The first 2 weeks of your medication, if you take your drug for religiously for 2 weeks, you cannot spread the disease. You have the disease, but you are no more infectious. You cannot
Okay.
transmit it to the other
To
person.
other persons.
But you have the disease, so you now take the drug for the next 5 months.
To be able to cure the
To
disease
cure
and
it,
free yourself.
Free yourself.
of
But the
disease.
first 2 weeks of your consumption of the anti-tubercular drug,
Yes.
you cannot infect others.
Okay.
Do you understand? That's why we
Okay.
say early diagnosis.
Okay.
Once you know you have TB, quickly go and take your drug for first 2 weeks. Once you take it for first week, you'll be okay. You'll be okay. And once I cannot spread it to another person. So I don't understand. See, until when we because this stigma, even in workplaces, she's working in the private sector, and then we have issues where people will
Start in the first place.
So what you just need to take 2 weeks leave from your annual leave, go and treat yourself. After 2 weeks, you come back to work. You are not
But
infectious.
then you don't really blame the people who do not even confess to their management because of the stigma and the possibility of losing their job.
That is why we are using the opportunity. She is working in private sector. We're using the opportunity. That's why I'm coming on here to say this. You are not. Once you take your drug for 2 weeks, you are no more infectious. You are no more infectious. Once you open up, tell your HR, tell them you've gone to our facility, you've been diagnosed to have TB, and then they're giving you drug for 2 weeks. They will give you drugs. They will ask you to take drug for 6 months. For the first 2 weeks you've taken that drug, you are not infectious. You cannot transmit that disease to someone else.
Will the hospital give the person a
Yes,
dose?
we give.
They do rights to say this person is no longer.
Request for that.
Okay.
I want to jump in now. The employers, even in the private sector, they request for a fitness certificate.
Okay.
Clearance form.
Okay.
From the health facility that is treating such patient.
Okay.
So this person is okay and can return to work.
Hmm.
So the private, and that's part of the benefits of this mobile app that I also spoke about earlier, because it enables you in the workplace to screen your staff members.
Okay.
And we call them presumptive. You are not identifying the individual as having TB, but there's a series of symptoms on the app that you ask questions.
Okay.
And the staff member answers those questions.
Okay.
If in the affirmative,
Okay.
and you presume that that person might have TB,
Okay.
the app is linked to these accredited health facilities that Dr. Shukoya.
Can anybody access the app you're talking about, or is just for the government hospitals and the private organizations?
Well, it's a hub and spoke thing, and so
Okay.
there are organizations that can work with the app.
Okay.
So what we do
Okay.
in the private sector is when we also train the occupational physicians, HR officers, we get them trained on how to use the app, and then they are linked to the bigger hub. And we're
Okay.
getting referrals,
Okay.
Once they find such presumptive cases, they refer them to these facilities where they do proper diagnosis, and if they are found to actually have TB, and then they are placed on medication.
Don't treat yourself if you have tuberculosis or you are suspecting that you have tuberculosis. Government hospitals across Lagos are available free of charge. Tests, diagnosis, and treatment for 6 months all free, done by the Lagos State government. You can go to a general hospital or a primary health care center for simple, treatment. And you can also return to work after the first 2 weeks of treatment. That's all. Our guests have told us this morning about tuberculosis as Health Matters, the segment on the Bumper Breakfast Wednesday edition. I want to say thank you to Dr. Olubumi Obudu, she's a public health pharmacist, and she's the team lead with Anada Consortium. Thank you for joining us on the Bumper Breakfast this morning. And the Deputy Director from the Ministry of Health. She is the Program Manager for TB, leprosy, and Buruli Ulcer Control Program. That Buruli Ulcer, I have to come and talk about it. Dr. Shukoya, not today. Dr. Olushola Shukoya is here with us this morning as well. Thank you so much for bringing your wealth of knowledge to the show. Last words.
Okay. My last word will be TB control efforts require multi-stakeholder participation from both the public and the private sector. We need to have collaboration between the public and the private sector to actually end this TB spread. And so we support from the private sector will go a long way to eradicate TB in our society.
Last words from you, Dr. Shukoya.
Yeah, TB is a communicable disease. Disease. It's preventable, it is curable, and finally it is free. Diagnosis is free and treatment is free for 6 months.
Thank you so much. We take a break. When we come back on the show this morning, we're rounding off the business. I want to talk business, but don't worry. Stanley Polika will be here. Let's round up the show and hand over to Stanley to give you sports report for today.